Do any of you worry about getting dementia? I think a diagnosis of dementia strikes more fear in our hearts even than cancer because it just feels so hopeless. Well, I have had that diagnosis and I did live to tell the tale. So today I'm here to share with you my favorite message, that dementia is not a death sentence. 13 years ago, when I turned 50 years old, I developed dementia. I gradually came to realize that I was becoming as cognitively impaired as the patients in my Alzheimer's clinical trials that I was conducting. I would give them 3 words to remember in the mini mental status exam that I had used thousands of times before over the past 20 years. But I had to start writing down the answer because I could no longer remember those words. I started having trouble using a computer. I forgot how to do things that I previously knew how to do, and I would drive my husband crazy because I kept asking him over and over to come and show me how to do things and how to make them work. I started having trouble driving a car. I completely lost the ability to back up or parallel park my car. Even dialing a phone number became a stress-filled event. I would get confused, and sometimes it would take me multiple tries to dial the call. And it got worse. I developed auditory processing problems. I was just hearing a snatch of every word. So I thought I had a hearing loss, and I kept going to my ENT doc and begging him to give me hearing aids. And he kept telling me that I just had a mild hearing loss and I didn't need any hearing aids. Then one day, he looked at me funny and he said, "Kat, this isn't in your ear. This is in your brain." And so here I was, a geriatric psychiatrist, an Alzheimer's researcher, developing my own case of dementia. Well, that was 13 years ago, and the life expectancy with dementia is generally about 10 years. So fortunately, I had enough brain cells left that I was able to start learning functional medicine, which is what I use to reverse my dementia. I had to close down my research center and move all my trials to another site, and it was really a daunting 3-year journey of not being able to work and having such a hard time functioning. But there came a day when I could hold the 7 digits of the phone number in my head again and dial the call. So my brain had come back online. Since then, over the past 10 years, I've had the great pleasure and honor to help my patients halt and even reverse dementia. But I'd like to fast forward to the summer of 2022. I was the principal investigator working on a team with Dr. Dale Bredesen on the first proof of concept trial using precision medicine to reverse mild cognitive impairment and early dementia. Our unprecedented trial results were published this past summer in the prestigious Journal of Alzheimer's Disease. Okay, I think that's the wrong slide, but let's see if we can go back to the other one. There we go. Okay, so now in all of the previous trials with Alzheimer's disease, there has not been a single medication that's really found to improve people's cognition for long. So these trials were considered successful if they simply slowed down the rate of decline, as you can see in this picture, the previous trials compared to our trial. So using the precision medicine approach, in our trial, we were able to show improvements in 84% of the 25 patients in our trial. And quite a few were testing completely normal by the end of the study. We also saw some completely unexpected findings that were never seen before. We were actually able to see statistically significant improvement in our patients' MRI head scans over the course of the 9 months of the trial. So now we have more than anecdotal case reports. We have very clear data to show that when we address all of the underlying factors that are causing the neurodegeneration, we can halt and even reverse dementia. So I will leave you with my favorite slogan, and I hope you can help me to share this message of hope everywhere. Dementia is not a death sentence.